Hello, everybody. Well, here I am, back once again, remembering with fondness and affection my visit here a year ago when I had just become the chair of the Appropriations Committee. We were looking into the bleakness of sequester, and I first of all called you the National Institutes of Hope. And I'm back here to say you are the National Institutes of Hope. We love you. We're proud of you. America supports you. And we want to do all we can in the federal law books and the federal checkbooks to let you be you. Now, I did promise that I would go back, that I'd work on a bipartisan basis, a bicameral basis, to work my earrings off to make sure that we canceled sequester, that you had certainty in the budget, and that we could deliver for fiscal 14. Well, I'm back, and if you notice, I have no earrings on. I did work them off. I just wish that fighting for you was aerobic, so then I would meet those BMI index things that you all put out all of the time. But I'm here to say I know that it's been a very hard year for you. And I know it's been a difficult year, not only because of the stormy weather outside, but the stormy weather within the United States Congress and within our budget. I know that you face sequester. I know that it cut NIH by 5%. I know it lost out on competitive grants, fewer patients admitted to the clinical medical center. It meant that breakthroughs that we had thought that we could achieve wouldn't be able to be done. And that every day, that instead of thinking about new ideas for new cures or the containment of things that we know like Alzheimer's, where just even 3 years of cognitive stretch out would have a tremendous impact on a person's health, the family budget, and the federal budget. We know what you faced. And if sequester wasn't bad enough, then we came to that famous 3 weeks in October when we faced shutdown. Shutdown, slam down politics. For 16 long days, I knew that 74% of the NIH employees were furloughed. I couldn't believe it. I just couldn't believe it, that for 3 weeks we were in this shutdown. I knew the outstanding work that you had done. So instead of pinning medals on the NIH employees who do the research and the wonderful support staff that enables you to do your research, from the lab techs to the facility managers, everyone was being told that they were non-essential, shutting down the doors of the clinical centers, shutting down the doors of NIH. Now, there were those that wanted to open and we shamed them into it. We took to the floor. Tom Harkin, Barbara Mikulski, we were like a flying squad. If the Ravens' defense had been as good as Tom and I, we would have been in the Super Bowl. And then they said, well, we'll fund NIH, but nothing else. That was a tough decision. But we said, we need NIH, we need FDA, we need the National Science Foundation, we need to have a government that people could count on. So thanks to the steadfastness of President Obama and all of our hard work, we were able to do that. And as a result, because of really willing to stare down the shutdown crowd, we were able then to get an agreement to go for a budget in which Senator Patty Murray and our very own Chris Van Hollen from Montgomery County led the way, working again on a bipartisan basis with Paul Ryan, and we got a federal budget. And what did that mean? Thanks to Senator Murray, we've now canceled sequester for 2 years. There will be no sequester in fiscal 14, and there will be no sequester in fiscal 15. We just won't do it. And then what also Senator Murray was able to do, working with Chris and Paul Ryan, we were able to come up with what is called the 302A. That is what is given, the 302A of the Budget Act. 302 of the Budget Act gives to the Appropriations Committee the block grant to spend on discretionary spending. It's called the top line. There was a big difference because we had a different top line than the House, a $90 billion difference. And the $90 billion difference came because of labor HHS, where we had a $50 billion difference than the House. So when I started my negotiations for this year, the House was at 2003 levels. 2003 levels. We said, hell no, that's got to go. And there we were working through the holidays, but we were happy too, because the real present is we wanted to be able to deliver to the American people an appropriations they could count on. And I must say that in the Senate, I had the full cooperation of Senator Richard Shelby of Alabama, my Republican vice chair. We worked in a way with the House, Congressman Rogers and Congresswoman Nita Lowey, and we had a couple of rules. Number one, we would function with civility. Number two, we wouldn't negotiate through the press. We would negotiate directly with one another. Straight talk, bottom lines, no stuff. And it took a lot of work and a lot of concentration, but we were able to do it. And we produced the bill that has funded now fiscal 14, where we were able to increase the NIH budget by $1 billion. By $1 billion. Now, the president wanted another billion. We knew you wanted another building. And it's not only what you wanted, it's what you actually need to kind of do the work that needs to be done to do the mission of the National Institutes of Health and all of its institutes and what we want to do. That's where we'll come to fiscal 15. But for this year, with the $1 billion more, we know that, first of all, there will be certainty, no sequester. There's also another certainty, that there will be no shutdown in fiscal 14. So both here on this campus and at the extramural campuses, the research universities, they will be able to have certainty in the budget. And for the federal employees, including the blue-collar workers, we had a very modest, even Spartan, but nevertheless COLA increase of 1%. I would have liked to have been more, but at least we wanted to say the people really deserve more and deserve better. This will mean a lot. We have now included money for the BRAIN Initiative, over an extra money for the President's BRAIN Initiative to be able to do the important work in Alzheimer's, autism, Parkinson's, schizophrenia, all the things that need to be done. We've also increased the funding for something near and dear to me, which is the NIH Office of Women's Health. It will have $41 million for fiscal 14. And then in breast cancer research, it will have close to $900 million. This is a long way from when I first met with Bernadine Healy so many years ago to talk about this new office that we hope would be new hope and new opportunity. I think about Bernadine Healy, and I think about Ted Kennedy. I think about how we worked across the aisle to be able to get the job done, where we worked with the Republican president and the Democratic Congress, with the head of NIH, whose party we do not know, nor does it matter. Nor does it matter, because when it comes to what is the role and mission, we don't belong to a political party. We belong to the red, white, and blue party. It's called the United States of America, the USA party. and that's who we are. We need to go beyond politics for what we do. So as I look ahead for fiscal 15, thanks to what Senator Murray and Paul Ryan did, we have that top line. We get the president's budget in just a few more weeks in March. We intend to move very quickly in terms of our appropriations. It will be our goal for this year. Not only will we not have sequester, but I want no lame duck session, and I want no shutdown on October 1st. And you know what, deep in my heart, I'm going to do? Senator Tom Harkin, who is now serving his last year in the United States Senate, I want him to be on the floor of the United States Senate with the bill one by one. Senator Harkin has not been able to bring up the labor HHS bill since 2007. Certainly, in 8 years, we can now find a way for him to bring to the floor the labor HHS education bill. NIH is in it. Let's debate it. Let's offer amendments. And for God's sake, let's pass it. So, friends, as I look ahead to 2015, we're already planning our work, planning our goals. I've already given my earrings away, but I will tell you, I'll work off these extra calories. I will burn the midnight oil to do what it takes to make sure that we preserve innovation, opportunity, and social justice in the United States of America. And where we want to promote innovation, we want it to be in our field, particularly in life sciences, where we're going to save lives, where we'll come up with new ideas even to save the planet, where young people in our own country can dream that if they work hard to get their master's, to get their PhD, to get their MD, that they will have the opportunity to get their grants funded, so that at the end of the day, it's just not 10 or 15% who get their grants. And for people all over America who are struggling, thanks to the Affordable Care Act, they're going to have access to medical care. But when they walk into their doctor's office, we want those doctors to have the tools that they need to be able to help those people either contain chronic illness, deal with that dreaded C word, or the epidemics of autism and Alzheimer's that we're facing. That's what we want to do. And you know what? The American people want us to do it. Everywhere that I travel, both in my own state and throughout the country, the National Institutes of Health is the most well-known and the most revered institution in the federal government. And you are beloved because they know every day, in every way, you wake up not thinking about you. You wake up thinking about we, the people, and how we can help the people be able to have opportunity and hope when they face these medical situations. So I'm here today to just let you know where we are, where we're going, that we do think about you, we do care about you, and we do want to let you be you. So God bless you, God bless America, and may the force continue to be with us.